California Pediatrics, a podcast by pediatricians from the 4 California chapters of the American Academy of Pediatrics, AAP California Chapter 1, 2, 3, and 4. 4 chapters, 1 state, 1 voice. In 4, 3, 2, 1.
Hi, I'm Dr. Grant Christman, a pediatric hospitalist in Los Angeles. Welcome to California Pediatrics, where we discuss topics of interest and spotlight on the professional trajectory of our guests.
And I'm Dr. Ilan Shapiro, also a fellow of the American Academy of Pediatrics, and our guest today is Dr. Jeff Birnbaum, and we'll be discussing a lot about pediatric gun injury and how to prevent that, a conversation that is close to our hearts, and especially right now, so important. Dr. Birnbaum, thank you so much for being with us.
Thank you both. Yeah, this is a topic that's near and dear to my heart. Can share a little bit about my background. So I trained mostly in the South. I was in pediatric fellowship in emergency medicine when I was seeing firearm violence on, if not a daily basis, a weekly basis. And whether this was inflicted injuries, suicide, interpersonal violence, domestic violence, unintentional injuries. I have very real patient stories that I still think about that resonate with each of those topics. But this coincided at the same time, 2018, where my alma mater, Marjory Stoneman Douglas High School in Parkland, Florida, suffered a mass shooting. And that really lit a fire under me to want to do something for my patients, for my community, to get more involved. I feel really uniquely lucky to be able to speak out about this and really advocate for our patient safety and trying to do what we can as pediatricians, as parents, as family members to prevent avoidable firearm injuries in pediatric patients.
Thank you so much. And I want to do a complete disclosure. This is such an important topic, and we brought an expert that has had the experience and knowledge, and please be with us. Send us your questions, your comments. Make sure that you share with someone. And if there's something interesting that you want to share with us, let us know, because we are completely here for you. Grant.
Yeah, and I think all three of us have seen this in our careers way too much. And even one event like this, of course, even one injury is too many, but could you tell us a little bit about how big of a problem this is in terms of where it fits in the spectrum of child health?
Yeah, thank you for asking. I'm so happy that our Surgeon General a few years ago finally reported or declared that firearm violence was a public health emergency and an epidemic. What we know is that about 50,000 people are injured or killed by firearms annually, and how I like to think about that, it's about the size of a baseball stadium, to put things in perspective. So it's really a large magnitude problem. And when we focus on pediatrics specifically, as of 2018, firearms have now surpassed all other causes of pediatric death. That's a really big statement. The data still shows that going forward, that more than cancer, more than heart disease, more than motor vehicle collisions, any other injury prevention or unintentional injury to children, firearms are by and far the largest cause of morbidity and mortality. So it's something that I think about a lot. I think as pediatricians, that's something really important. It's on a lot of our families' minds. It feels like a day doesn't go by where there's not another shooting. But one statistic I like to point out, only about 1 to 2% of gun violence is from large-scale mass shootings. It's really the day-to-day neighborhood community level of violence that really gets to me.
The ones that we usually don't hear.
Yeah. I think that those silent stories that, they're going to come into your clinic rooms, they're going to come into your emergency department, into your hospitals, and, outside of the hospital home, just in community centers and schools. This is something that we all think about. I think it's hard pressed to find somebody who has not personally been affected by firearm violence or who knows somebody who has been affected by firearm violence.
One of the things that it's hard as a pediatrician to start this conversation. I was in Florida with a lot of conversations when I was actually working in Fort Myers, Florida over there, and right now here in LA. And what would be the best tools as a pediatrician to start learning about this topic? Understanding that it's a public health concern. It's something that me as a father, also as a pediatrician, I'm extremely interested because I want to protect my kids the same way that I want to protect myself and my community. What tools as a pediatrician we can start having?
So I think the most important foundation is really just building trust with your patients. Unfortunately, gun violence has become politicized, and really we're talking about preventing injury and harm to children. I think when you frame it in that way, no parent wants their child, to be hurt or suffer at the hands of anything, especially firearms. So by keeping it rooted that you're on the same side, you're just trying to prevent harm, injury to children, to me it's no different than how we talk about seatbelts and car safety and car seats, how we talk about drowning, poisoning prevention, that this is a part of our job in educating families. So that is probably my first biggest advice, to just lay a foundation of trust and try to get over to your family's side. The other advice I have is this doesn't all have to be done in one visit or one encounter. So I feel that you can meet families where they're at. We'll get into a little bit about safe storage in a minute, but I like to say, if a family has a loaded firearm in their home, they may not be at a point where they're willing to load or store it unlocked, or store it locked, I apologize, and unloaded, but maybe they will store it locked but still loaded, but making small incremental steps and really just trying to keep as non-judgmental, as impartial, as much of a framework of allyship that you can with your families is going to be the most crucial aspect.
That's really interesting because it makes me think about my training experience and being taught to ask every family in every H&P I did, do you have any firearms in the home? And from things that I've heard since then, maybe that's not the best way to pose the question. And I think about what you were saying about safety. Is there a better way to ask families about this?
Yeah, I love that. So some of the language that I like using is, does your child spend any time in a home with a firearm? So that does two things. One, it automatically takes the assumption off that the family is doing something wrong by having a firearm in their home. And I don't think that that is anyone's intent, but I feel like the wording of the question can sometimes convey that. But two, it also gets an important topic that firearms are so prevalent in our communities that even if your primary residence doesn't have a firearm, it could be a play date, it could be a family friend, it could be a distant relative, that I do think that this topic becomes really important. And I think that we as pediatricians need to broaden our scope in terms of how we're thinking about firearm access to children.
I completely agree with that part. And what's the most common questions or barriers that you think that us as pediatricians, we should kind of be jumping? I hear right now the part of level setting our conversations on a matter that we're reflecting our patients, our community. And it's not just the question, it's actually being neutral and non-judgmental. I love that part. Is there any other tips that we should be looking for?
Yeah, so I think if the question is, how can you, best form a partnership with your families? So I think first understanding that you may not know exactly what their life is like, where they come from, how they were raised, how their thoughts about, how to keep their kids safe were formed. So I think opening with a dialogue that, how do you feel about firearms? What does keeping your child safe from firearms mean? A lot of families that we serve and take care of, they may have suffered firearm violence themselves, and sometimes it's from a close neighbor or community member, and they feel that the best thing for their child is actually keeping a firearm, to keep their firearm in the home to keep them safe. So I think listening more than we talk can be really helpful in starting to form that allyship. And then I do feel like there is a wealth of evidence that having a loaded firearm in the home is more likely to injure a child, that most firearm violence is perpetrated by somebody close to that individual, whether it's someone who lives in the home or a close friend or acquaintance. So I do feel that there are pieces that we can impart, but first comes the trust building, and that's key to everything.
And we've talked a lot about firearm violence, but there's another dimension of this that we haven't talked as much about, which is the way the role firearms play in the mental health crisis that our teens are facing. And I was wondering if we could talk about that angle a little bit.
I love that question. So firearms, we know, if we look at mortality, morbidity by intent, that only about 10% of firearm injuries are unintentional, meaning, a child accidentally got access to a firearm and suffered harm from it. The vast majority is both interpersonal violence and suicide. We know about 30 to 40% of firearm deaths are caused by suicide. So there is a term called lethal means counseling, and this is something that I have been talking a lot about, and a lot of my colleagues in this space talk a lot about. And what we know is that the rates of suicide completion with a firearm are so much higher than any other means that just getting that firearm away from the individual in a mental health crisis has more of an effect on almost anything else we can do in terms of their safety. So it's such an important question. I think that as medical professionals, as community members, as caring for our loved ones, having these conversations is so important, and really focusing on people undergoing mental health crisis and making sure that we're having conversations specifically with them, or in the case of pediatricians, with their family, is really important to broach that topic.
I would love to start shifting the gears here. And I'm your patient, I'm your father that's coming to your office. What do you think that I need to ask you about this topic? What things me as someone from the community, what things should I be seeking information for this topic? Because sometimes we hear all these things, social media, Instagram, TikTok, media, and me as a patient or as a father, sometimes I just don't know what to ask about this topic.
Yeah, so I think one of the first things I want to bring up is that a lot of families who own firearms, they will largely report their child either doesn't have access, or if they do have access, that they do not know the combination to the lock or however it's secured. But we have good data that this is likely not the case, and that many children, teenagers, have not only accessed the firearm, but as of 2017, about 5% of high schoolers report handling a firearm within the last 12 months. And this is excluding those handling for sport shooting or for hunting, but just handling a firearm in the last 12 months. So I think broaching that topic of having a firearm in the home, I don't feel it is a safe assumption that your children are going to know to stay away from it, even if you tell them that children are going to be curious and they are going to get into firearms. So I think that's one thing that would be helpful to talk about. Number two is that, and again, I'm hitting the same points, but we don't know where families come from. So I think as a parent asking about firearms, I think it is fair to ask, well, what is your experience with firearms? What do you know about firearms? Have you handled firearms? Do you own firearms? And getting to know their experience. Because how I'm going to counsel somebody who has never handled a firearm, doesn't have any firearms in their home, I still may bring up the topic because, their child still may enter into a home with a firearm. And I think it's important to have these conversations. But that's going to be very different than somebody who's grown up around firearms their whole life, who feels very comfortable around firearms and may even be teaching their children how to handle firearms safely. It's still important to have that conversation, but I think meeting the families where they're at and asking what they know and what they want from the encounter can be helpful as well.
Thank you for that. And I have a follow-up question on that one.
Please.
Same, me going to your office. I have my teenage girl, my teenage boy, and I want to start this conversation with them. Mm-hmm. Sometimes we know that, even with little ones, it's a hard conversation to have, but is there any pointers for parents on how to start that conversation about safety?
So I would treat it the same as you would for any other injury prevention. Your teenager is not going to want to talk to you about wearing their seatbelt in the car. They're not going to want to talk to you, about making sure they're being safe when swimming. So I feel like just as community members, parents, pediatricians, it's really important to still have these conversations. And also we know that children, teenagers are much more receptive than they appear. So just having these conversations with them can have a lot of impact, even if there's no outward expression initially.
Thank you for that.
So just continuing the focus on how we talk to families, you talked a lot about lethal means counseling. Do you want to elaborate that on that a little bit, or is there anything else you think is really important for pediatricians to talk about during, for example, a health maintenance visit, because the time is so short and everybody is looking to make the most out of the time they're spending with families?
Yeah, 100%. So I think that talking to your families, or maybe I'll start like this. So it's important to screen families. But what do we do when they say yes? And we've talked a little bit about, having this conversation, being non-judgmental, at times letting them lead, listening. But at the end of the day, there is a wealth of evidence around storing firearms unloaded, locked, separate from their ammunition is really impactful in reducing harm. Not just unintentional injuries, but we also see harm reduction in interpersonal violence and suicide. So when we're getting on lethal means counseling, so as pediatricians, we need to own that. One of the unique things, I practice in Los Angeles. We have a program where we're able to distribute cable locks to families in need free of charge. Now that may not be available everywhere, but a cable lock, if you go online or to your store, you're talking about a $10 investment. What a cable lock is, I can just elaborate a little bit. It's basically a secured locking device where you have to unload the gun. You cannot store it with a magazine in it, so it already takes care of having the gun unloaded. And then all we're asking families to do is then store that ammunition in a separate place. Now, cable locks are not the end-all be-all. They actually have very cool new technology, these biometric safes and biometric locks that can actually, similar to your iPhone, can use actually a fingerprint or facial recognition data in order to unlock the safe. So then you are preventing anybody who does not have authorized access. Now these can still be cost prohibitive. There are programs that are working towards lowering these costs and grants that are working towards lowering these costs. But I think having something that you can direct your families to, and it may not be a free cable lock, but it may be a website or a local firearm dealer that can distribute a firearm lock at relatively low cost, can be really helpful as a follow-up for these families.
That's great.
Dr. Birnbaum, we're sadly getting close to the last part of this conversation. Knowing that there's a lot of things happening in the world, what would be a couple of tips on us as pediatricians to start this conversation? Because I know that it's extremely important to go directly to our patients, to our families, to ourselves, to do a safety check also what we're actually doing, but also what things can we start moving and start that conversation with other communities? Yeah,
so I think my first piece of advice is really don't accept firearm death as an inevitability. That there are things that we can do. Owning a firearm does not necessarily mean that you are necessarily subjected to increased risk of death. And I think meeting families and helping them, guiding them just as we would with any other injury prevention topic on ways to store and secure their firearm safer is going to be key. Another thing is I think it's important to get out in the community. There is a wealth of information that is distributed outside the traditional medical home model. And I think being an ally to local community groups, to school districts, to religious organizations, I think there's a lot of opportunities to meet families in their own community and outside of our traditional home and medical model.
That's really great. I have one follow-up question, which is for our students, residents, early career pediatricians listening to this who want to become advocates themselves on this issue. Other than getting connected with community organizations, is there anything else they can do to learn more about this or get more involved in advocating for firearm injury prevention?
I appreciate the question. So I will do a shameless plug for an organization that's near and dear to my heart called the Bullet Points Organization. It's out of UC Davis. They have a wealth of information geared towards both young pediatricians in training, medical providers who are more seasoned, as well as family members. And they have both lectures and information that you can disseminate. They also have information geared towards families. So it's really a wealth of information. That would be a good starting point to get involved. But there are organizations who are already doing this good work in your community. So getting a lay of the land wherever you practice, wherever you may be, I guarantee that there are people who are also fighting for child safety and fighting for preventing firearm injury, death, and morbidity, especially in pediatrics. So getting to know the people who are already doing this good work and seeing how you can get involved.
We know that we're getting close to the end. It's important to remind ourselves that as pediatricians, we talk about a lot of very sensitive topics, and we go deep inside, and we should feel comfortable to have enough tools and resources to start this conversation, because the same way that we want to make sure that our patients do not have anemia, we make sure that, we're preventing any type of problems. And we have seen it with accident prevention, drowning opportunity, there's a lot of topics, and this should be one of the ones that we are trained, we're ready for that part, and most importantly, to start the conversations. And for every parent that they're actually hearing us, make sure that you answer questions. Put us on the spot. Make sure that we actually are ready to answer that part, and I promise that if we do not know, we will actually train and call you back and give you the answer.
That's great. Thanks, Ilan. Dr. Jeff Birnbaum, thank you for joining us on California Pediatrics.
Thank you both.
Hey, Ilan, that was a really interesting and important discussion, and I think though we sort of know this intellectually, it's important as pediatricians for us to keep in mind the fact that firearm injuries are the number one cause of death in children.
I completely agree, and as a pediatrician, most important as a father, that's a topic that I want to actually have with my families, with my patients, and also with my kids, because the same way that we talk about like influenza and we talk about lead and other stuff, this should be normalized and be part of the conversations, because there's no barriers for it.
Yeah, and I think as a hospitalist, I tend to also focus on a lot of the conditions that you're talking about, like RSV bronchiolitis, which of course is really terrible for young kids, but this just looms large as a really important topic that we often don't touch on enough and often don't feel comfortable talking to families about.
Yeah, no, and I love actually the website that Dr. Birnbaum was actually sharing with us, that should be done by all the residents and all of us, and making sure that we have the tools also to help our community and be ready. That part of it doesn't need to be in one sitting; it could be in many, but having that conversation can actually save lives.
Yes, and I really appreciate learning an approach to talk about firearm safety from that perspective, and in a way that is not non-judgmental towards any particular family or particular home that may have firearms.
It's a reality, and I wish that like polio, this will slowly go away, and everybody will be okay. But it's something that we need to continue having that conversation, making sure that we're open for it.
Yeah, so I hope that for the students, residents, and younger pediatricians who are listening, that they will make this a part of their practice when they do checkups, and then also maybe considering taking this up as an advocacy issue as well.
I completely agree, and for those parents also to actually ask us questions, because we are there to, we talk about so many sensitive topics, and this should be one of the ones that are boiling up, and we need to resolve it.
Absolutely.
Thank you so much.
Thank you so much for joining us on California Pediatrics. We hope you'll join us next time.